Welcome to the Calhoun EMS program Clinical Orientation. My name is Kenneth Kirkland. I'm the clinical coordinator for our EMS program. We're going to start off orientation by going over our contact information so that if you need to get a hold of us with any questions or concerns during the course of not only the clinical program but the course of your EMS education, that you have our access to our information. This is also available on Blackboard under faculty information, and that's in either your EMT course or your advanced EMT course. My office number is listed up there, 306-2789. If you leave me a voicemail, please leave me a name, a number, and a brief message regarding your call. However, if you call on a Saturday or Sunday, your call is not going to be returned until the next business day. The fastest way to get a hold of me, again, is always by email, and that's listed up there for you at that kwk@calhoun.edu. Tyler Mosley is also one of our clinical coordinators. You may not see Mr. Mosley very much depending on what level of the program that you're in. If I'm out of town on business for some reason and you really need to get a hold of a clinical coordinator, I encourage you to get a hold of Mr. Mosley. So let's talk about how we get admitted to the clinical area. And the first one is that all EMS students, whether you're EMT, paramedic, or advanced EMT, have to meet the requirements right here on the left. And the first one is that we have to have a current healthcare provider CPR card. And there are three types of CPR that we accept in our program. That's the American Red Cross, the American Safety and Health Institute, and the American Heart Association. Each one of those is listed as something different. American Heart Association lists the healthcare provider, American Red Cross, the CPR for the professional rescuer. If you have any questions about the type of CPR certification that you're carrying, or whether or not that meets the requirements, I encourage you to ask one of your EMS instructors or shoot us a picture with your phone, email it to us, and let us give you the final word of approval. You're also required to pass a drug screen or background check. That's through that employment screening services that we talked about during the first few weeks of orientation. You're also required to have a clinical scheduling or tracking account. You have to have an average of 70% or higher in the class in which you're enrolled in, whether that be advanced EMT or EMT. And then as far as current clinical paperwork on file, you have to have your health screen and physical completed, copies of your immunizations on record, TB skin tests, flu vaccines if you're in the spring or fall semesters, and your EMS program application on file as well. Advanced EMTs, you have a little bit of extra work on you. You have to have a copy of your valid EMT license for the state of Alabama on file with us. You also have to have successfully completed the drug dosage exam with a 90% or higher within 3 attempts. And you have to have a successful IV and IV medication administration checkoff with an instructor in the lab. As far as uniform policy goes, just a quick reminder, all divisions of the Health Sciences Division are uniformed, and we're identified by our program by the color of the uniform that we wear. And you see the examples there. EMTs, we wear navy blue polos. Advanced EMTs, we wear the gray polos. And then paramedics, you have the red polos. All of these uniforms all bear the Calhoun EMS program symbol over the left breast. As far as clinical attire goes, we'll maintain the same uniform policy. However, you do have to have 2 shirts minimum. That's an OSHA requirement. One to wear and one to serve as a backup in case you get any type of bodily secretions on your uniform. Shirts must be tucked in neatly at all times and clean in appearance. Probably as far as clean in appearance or tucked in neatly, the biggest things that we really see or have complaints on from the preceptors is that the type of material that our polos are made out of, after 1 or 2 times through the dryer, the collar starts to curl a little bit, or you start to get some wrinkles in it from where maybe it's laid on the back seat of the car for a little while. Please just take a warm iron, rub over that shirt, and just make sure that we get those creases out of there. But just, again, be neat in appearance. As far as pants go, they need to be navy blue or black in color. No denims allowed, and the backup pair, again, is required for as that OSHA requirement. Shoes need to be clean. Solid black, and you can wear shoes or boots with a rubber sole. If you've not purchased these for clinicals yet, I encourage you to get the ones with the non-slip sole if possible. If you're in the spring or the fall semester, you know that the weather's a little cool right now, so you can wear a coat to clinicals as long as they do not bear the department patches or logos. Must be navy or black in color. An approved jacket's available in the bookstore should you choose to purchase one. If you have any questions about the uniform jacket that you want to wear to clinicals, if you just bring it and let one of your EMS instructors look at it, or bring it up here to my office and we'll take a look at it and we'll give you the final word of approval. We can't allow you to wear a uniformed a department patches or logos on those jackets because you're a Calhoun EMS program student and you're not representing that department at the time that you're on that clinical. As far as jewelry goes, wedding bands, wristwatches, one pair of stud earrings, and medical alert tags. Nothing else and no exceptions, so no nose rings or lip rings, etc. Visible tattoos, these need to remain covered on clinicals, including your EMS and fire department clinicals. This is a requirement of the clinical agencies. They've recommended that their employees do the same thing, so we're held to the same standards as them. So just please try and cover that tattoo up with some type of arm sleeve or a bandage if necessary. Undershirts for under the polo need to be white, navy blue, or black in color. They should not have a visible design on them. Long sleeve shirts are permitted if you're cold-natured or if it's during that winter season, January through April or October through December. Your Calhoun ID badge is required for all clinicals. No other badges shall be worn with this, and there's no exceptions. Students showing up to a clinical without their student ID badge on will be sent home. Hats are an optional piece of the uniform. If you choose to have one, then you can buy one at the Calhoun bookstore. Otherwise, they're not a requirement for clinicals. However, if you do purchase one, it's not to be worn indoors, and you have to remove it prior to entering the station or the hospital. Some notes on grooming and hygiene. Hair has to be neat, clean, and pulled back. If you have long hair that extends past your shoulder blades, you have to secure your hair twice so as not to become a safety hazard with the type of equipment that we use. Facial hair has to be trimmed and neat in appearance. You can have beards and you can have mustaches. They need to be neat in appearance. Fingernails need to be trimmed short, no fake nails, and no nail polish. Grime and debris must be cleaned from beneath the nails, and there's no exceptions. Believe it or not, we have had students sent home because of hands looking like the picture that's shown on your screen. Deodorant is required for all clinicals. Cologne, perfumes, lotions, or anything that emits an odor, including aftershaves, are not permitted. Bathing is also a requirement. As far as general guidelines go for clinicals, you need to stay in your designated area with your preceptor unless told otherwise. It is okay for you to run some blood work over to the lab if it's a small ER that you're visiting on a rotation. However, that is only with the permission of your preceptor. So please don't let them catch you in any other area of the hospital unless you've been told to go there by your preceptor. No personal phone calls or visitors are allowed during the clinical shifts or while at your EMS and fire department field sites. Any report of this results in a failed clinical. You're also not allowed to have cell phones, radios, or pagers. You can have your cell phone with you in your book bag or your purse if you're carrying that with you into the facility. However, it cannot emit an audible tone or be visible on your person at any time during the class or clinical component. Probably the biggest hot button that's out there right now with our clinical agencies is social media websites, the old school MySpace or Facebook, Twitter, etc. There's been a lot of things you've probably caught in the news lately of students on clinicals, or they've been visiting areas that they've been taking pictures of themselves, these self poses like I've got up here on the screen. Any type of post like that regarding the clinical site, the faculty, preceptors, patients, etc., that subjects you to dismissal from the clinical class component and or the EMS program pending the investigation and the severity of the issue. So please, nothing says you can't post, had a great day at clinicals and 8 people like that. What you can't post is that you took care of the 17-year-old male with the cocaine overdose and he had so much white powder on his face he had to brush it off before you could do positive pressure ventilation. That you cannot post that. That may have been the only patient identifying information for that entire shift, and that it's being viewed as a potential HIPAA violation. So please don't post stuff like that. At any time, you're subject to inspection from the clinical coordinator, EMS faculty member, or their representative during a rotation. So you may see one of us popping in. If we do, it doesn't mean you're in trouble. It just means we're doing our job. Make sure that you're where you're supposed to be when you're supposed to be there. Students should strive to maintain a professional appearance and attitude at all times. In other words, be teachable. We show you several correct ways of doing things in the lab, and there's 100 different ways to take a blood pressure. So if your preceptor says, hey, I want to show you how I take a blood pressure, be teachable. Listen to what they have to say. The minimum BSI for your patient contacts is gloves, and Calhoun does require that you wash your hands before and after each patient contact with that facility's approved sanitizers. As far as HIPAA goes, don't speak, write, or otherwise communicate anything that could potentially identify your patient to anyone else outside of their immediate care team. Failure to comply can result in legal ramifications against you. You also need to know that you're not allowed to browse medical charts of patients you're not directly involved in the line of care with. So please be very mindful of HIPAA and privacy and confidentiality while on clinical rotations. You're also required to be on time and well rested for each clinical. If you're caught sleeping or not performing at the expected levels, you will fail that clinical, and this is also criteria for program expulsion. As you see here, the picture of the gentleman sleeping on rotation. No alcohol 12 hours before any clinical, no exceptions. If you're a witness discussing such behavior while at a clinical site, you'll fail the clinical and not return until you meet with the program director and either me or Mr. Mosley as a clinical representative. The biggest thing I can really say on clinicals is that you need to be active. The idea of this is to immerse you in the clinical environment so that you can learn how to properly care for patients either pre-hospital or in the hospital. And what I call a wallflower is those that they stand at the desk, they don't want to be involved in patient care, and the nurse has to come and get you to take you to the room to show you what to do. You need to be kind of self-motivated and ready to work when you arrive on clinicals. Don't go behind the nurse's desk unless you're invited by the staff or told that it's okay. Clinical site employees will be shown the same level of respect as the Calhoun EMS faculty. In some cases, you need to show them more. As far as breaks go, smoke breaks are not allowed. Doesn't matter if your preceptor goes out to the infamous quote-unquote gazebo to smoke. You are not allowed. You are a Calhoun student, and Calhoun clinical sites are an extension of the Calhoun campus. Remember, this is a way to get sent home early and fail a clinical. Meal breaks are permitted only after being excused by your preceptor and at an appropriate time to excuse yourself. So in the middle of the resuscitation is not a time for you to ask if you can go to lunch. You need to, most of the time our preceptors are awesome, especially in the ERs, about knowing how the day is going to be able to go based off of how many patients they've seen. And they send you to lunch either earlier than expected or sometimes they know when you need to go to lunch. Regardless of which, all our clinicals are 12 hours. You're permitted 30 minutes for lunch. Please be mindful of that time frame and return promptly. Any other breaks besides that are a privilege, and they're not a must-have. So if you get lunch then on an ER clinical and it's been a busy day, then you are a very fortunate person. Remember that most of the staff that you're shadowing or observing that day on rotation typically don't get a lunch if it's a very busy day. So again, just please be mindful that breaks are a privilege, not a must. Alright, so what to expect? Well, when we arrive to clinicals, who do we need to report to? If you're arriving to the ER, you have to report to the charge nurse. If you don't report to the charge nurse, they send you home. If you're going to the EMS or the fire department site, you can ask one of the paramedics or any of the EMS crews that are there. They'll know that you're a student. They'll be expecting you. They may send you to the supervisor to see which station or which unit you'll be assigned to that day. As far as you're there, work ethic goes, again, we've talked about being active. Please don't be a wallflower. You need to help everybody within your scope of practice and with what your preceptor feels comfortable with you doing. And the best way to help is that if they're in the middle of a phone conversation with a physician or another care member, or they're talking with a patient's family member, please don't interrupt them. Just wait until they're done. A lot of times they'll have pre-designated roles that they'll want you to do during the course of your clinical. You won't be ever by yourself in the course of a clinical. On the ambulance, as far as in the ambulance goes, when I had students, when I was working on the ambulance, I would often have the student observe the first call and then begin assisting as a team member for the rest of those calls, depending on the level of the student I was dealing with. On emergency calls, it is not uncommon for that paramedic to ask you to just kind of sit back and let the crews work as they need to. Just be mindful of that. It is their truck, respectively, and we need to be mindful of just, again, we're there as a privilege. So if they ask you to help or they ask you to sit back, just kind of be mindful of that. In the ER, in emergency situations, most facilities have a policy that if a trauma is what they call a level 1 trauma, a very, very critical patient is in the ER, they may not allow any students of any program in the room at that time. Just be mindful of that. Make sure that you can kind of position yourself at the door, though, to observe. But typically they don't allow students in the room on those just because of the high level of those patients. If it's a slow day in the ER and you're not seeing very many patients, this is the time for you to ask questions about the type of equipment that those nurses and physicians use. What do you do in these type of situations? Have them show you stuff. Okay, it's rare to have a slow day, so take advantage of it when you have one. When it's closing time, when do you give them your clinical evaluation? Anytime you're in the ER, the nurses are preparing to give report in the last 30 minutes of their shift. It's very important that you not interrupt the nurse during report to the next oncoming shift. So you may need to hand them that clinical evaluation an hour before the end of your shift and say, hey, I know it's not time for me to go home yet, but between now and the end of our shift together, if you would just please evaluate my performance today, I would greatly appreciate that. So if you don't know how to do something, tell them you'd like to see them do it first, and then you'll do the next one. Don't be afraid to say, I don't know how on a skill that you don't know. However, you need to also stay within your scope of practice. And if you go to your EMS 119 shell in Blackboard, over in the left-hand column under Clinical Forms, you'll find a clinical scopes of practice for our EMS program. I encourage you to go to that form and be very familiar with it. I also encourage you to print it off and carry it with you to clinicals. And that way it's a pocket reference for you and your preceptor if needed. Here we see a copy of the one that I just sent you to. And if you look, it's all identified again by the color of the uniform that we wear. So if you're an EMT student, you can do everything that's in this column and these medications. If you're an advanced EMT, you can do everything in this column plus the EMT column. And if you're a paramedic, you can do everything on this sheet and then some. If you have questions about your scope of practice or your preceptor has questions about the scope of practice, just have them contact me or get a hold of me somehow, either by email or by phone call, and we'll try and resolve the issue together. If at any time your preceptor should talk to you unprofessionally or you feel like you were treated unprofessionally, just quietly, don't make a scene of it, but just take note of their name and document the situation after the clinical. It's hard for me as the clinical coordinator to fix an issue when you come to me and you say, well, you know that brown-headed nurse that works on second shift at the hospital? Well, I could throw a rock and hit a brown-headed nurse. I need to know which nurse, what day, what was the situation, and I need to know some details. I can't promise that it will always be fixed. You know, some people just believe they put their pants on differently than you do. However, I will try and resolve that issue. This is a very, very rare occurrence. This has maybe happened twice in 5 years. But again, if it does, just quietly take note of what their name is and what the situation is. If it is bad enough that you feel that you can't complete the clinical, please get a hold of one of the EMS faculty members or me, and we'll try and resolve that issue that day. As far as time frame and with the clinical sites, you're to arrive 15 minutes prior to the start of the clinical. So if it's supposed to be a 7 a.m. till 7 p.m. clinical, I need to be there at least by 6:45. And that's, you're to report to the charge nurse or their station supervisor. And remember, they're very, very big on this. If you don't do this, they'll send you home and it's considered a failed clinical. The hospitals that we are affiliated with are Athens Limestone ER, Coleman Regional Medical Center ER, and then Decatur Morgan. We have 2 campuses that we can attend the clinicals at. You can go to the Decatur General Campus, and then Parkway Medical Center campus is reserved for EMT students only. Huntsville Hospital is reserved for advanced EMTs only and paramedics only. And then Madison Hospital is reserved for EMTs and advanced EMTs. As far as ambulance rotations go, Athens EMS, Coleman EMS, Decatur EMS, First Response, Greg's EMS, and HEMSI are all affiliates that we are able to complete clinical rotations on. These may vary by the semester, though, so I cannot always guarantee that these will be available during the course of every semester. If you have questions, just see your clinical coordinator. If you're an EMT student, then we'll have fire department rotations we'll also be attending, and that's with Decatur Fire and Rescue and Madison Fire and Rescue. Now let's talk about how we're going to document things that we do on clinicals. The first one is the clinical evaluation, and this form can be found under the tab Clinical Forms in your EMS 119 shell on Blackboard. These are to be completed by your preceptor at the end of every shift that you do. So if you're an EMT student, you have 5 clinicals. At the end of the semester, we should have 5 clinical evaluations as proof of your 5 clinicals. It's your responsibility to make sure the heading is completed. Evaluations received without a heading will not be scored, and an unsatisfactory or fail will be assigned. Only the physician, the RN, paramedic, or advanced EMT may fill out your clinical evaluations. We give you program envelopes that the evaluations must be put in by your preceptor. Those are sealed, and then the sealed has to be signed by the preceptor to count for a grade. It also has to be in the approved Calhoun envelope, so please don't stick them into one of those greeting card envelopes to turn in. Evaluations are due the next class day, no exception. So if I have class on Monday, Wednesday, Thursday, and I do a Friday, Saturday, Sunday clinical, Monday morning I will turn in 3 clinical evaluations to my EMS instructor. They'll collect those evaluations and submit them to me. Failure to follow these instructions will result in an unsatisfactory for each clinical that you fail to turn in. Here we're looking at an EMS 119 or an EMT student's clinical evaluation. The spot in the red that you see up here, I don't know if you can see my mouse arrow moving, but if you can, then you see it's right up here by the student's name. You need to fill out this section yourself. Please don't rely on your preceptor to fill this out. If I get an evaluation and it's filled out and signed by the preceptor but it doesn't have a student name on it, that's why I need your name on the envelopes as well. If it's not on either one of those, then it's just going to go in the trash can. If you're in the advanced EMT program, your evaluation looks a little differently, but again, the same thing. Over here on the right side, you'll need to fill out the top part. Any comments that you had regarding how well or what you expected the shift was going to go like, and then your preceptor can document their side. Over here, we have the bubble forms, and we can explain those a little further in detail in class. As far as patient care reports go, if you're in the EMS 119 or EMT program, you have to have a minimum of 15 patient contacts for completion of the clinical component. If you're an advanced EMT, you have to have a minimum of 25 patient contacts for completion of EMS 156. What's required on every patient is vital signs and whether it was a male or a female patient and what the age was, or demographic as you see listed here. All PCRs for that clinical will be entered into Platinum Planner and submitted by the next class day, no exceptions. Late PCRs will not be accepted. We give you a deadline of May the 11th to have all of your clinical paperwork, such as patient care reports, put into the computer. If they're not put in by that date, then if you're only seen 10 patients, then you'll be receiving either an incomplete or a failing grade for your EMT clinicals. And again, if you're only seeing 20 patients, you're supposed to see 25 patients. Again, it's either going to be an incomplete or a failed clinical, depending on the situation involved. Sometimes life happens, and we're going to be absent from a clinical. And there's a procedure that we have for what we need to do in those instances. You must notify the clinical coordinator before your shift begins, and you can notify me through email or phone. You do not have to call 25 times until you get an answer. It's only necessary to call one time and leave me a voicemail and just say, you know, hey, this is John Doe. I was scheduled to be at a clinical at Athens ER at 7 a.m. this morning. I was unable to make it to the clinical. Failure to do so, if you don't let us know, is considered unsatisfactory for that clinical. I do understand, though, that if you have a stomach virus and you're puking, that you're not going to stop, pick up the phone, and put Calhoun EMS program as your top priority. However, you do have within 24 hours to let me know that you're not going to be at that clinical that day. Tardiness, it's completely up to the clinical site whether or not they're going to receive you. Remember, we said you have to arrive 15 minutes prior to the start of the clinical. So we not there by 6:45. I show up and come dragging into the ER at 7:30, hoping to begin a shift. I'm probably going to be sent home by the charge nurse. You're held to the same standards that their employees are held to. And the way to view clinicals is that you are on a 12-hour job interview. So just please be mindful of that time frame. And again, it's not up to me. If the charge nurse is saying that she wants you there on time and you were tardy, then it's their right to send you home. And if they send you home, it will result in a failed clinical. We schedule all of our clinicals. You schedule them by yourself. And the way that we do that is through Platinum Planner. So as a general reminder, EMT students, you have to have 2 ERs, you have to have 2 EMS rotations, and you have to have 1 fire department. It is not optional as it's listed here on the slide by accident. Fire department clinicals are no longer optional. They are required. There will be no clinicals after May the 11th. Advanced EMTs, you have to have 4 ERs and 4 EMSs. And again, no clinicals after May the 11th. As far as rescheduling goes, that's subject to the availability and the situation, and it's done only through the clinical coordinator. You cannot just show up to the site without proper scheduling, and if you do, this is construed as unprofessional behavior, and it's going to result in dismissal from the program. The reason for this is because you are covered under Calhoun's malpractice insurance. When you enter yourself into a clinical shift, you're covered for that shift. So if you show up on a Monday and you were supposed to be there Tuesday, you're not covered under the malpractice insurance that day. So we need to make sure that we stay, you come through us to reschedule, basically. There is limited space availability in the spring. We currently have a little over 140 students going to clinicals, so I will tell you that the schedule is tight, but there is space for you to be able to go to clinicals. However, when you put that shift into the computer and say, this is the one that I want to go to, I highly encourage that you stick to that schedule because I cannot guarantee that you're going to get a chance to make that up. Again, just as a reminder, do every class day as the evaluations from the clinicals that you went to between class days. You cannot attend a clinical on a scheduled class day. So what happens if we're accidentally injured or we're exposed to infectious materials during clinicals? First thing that you need to do is wash the site with soap and water immediately. If you're pre-hospital and you don't have soap and water available immediately, use the hand sanitizer until you can get to the hospital. You need to notify your preceptor that you're with, whether that be the nurse in the ER or the paramedics that you're with at the fire or the EMS agencies. They'll notify me. If they don't, then you need to notify me so that we can guide you through the process of what happens next. You need to follow the facility's exposure control plan for the clinical at which you're at. So if I'm at Athens Limestone Hospital and I accidentally stick myself on a needle, I'll follow Athens Limestone Hospital exposure control plan. If I'm at HEMSI and I accidentally get hurt, the same thing. I'll follow HEMSI's exposure control plan. I also need to fill out the EMS incident report. And the incident report is located in Blackboard, once again, EMS 119. Over on the left-hand side, you see clinical forms, and you'll find the incident report there. I encourage you just to go and kind of look at it to see. It's kind of hazy here on this picture on my screen. Just take a few minutes and review the forms so that you're familiar with them if you need them. As far as equipment that you need your stethoscope with you to go to clinicals. You need a pen light, your student ID badge, an ink pen, EMS scissors. You need a watch with a second hand, pocket notebook, clinical evaluations, something to write on. You don't need the clinical PCRs. Let me go back. You need like a small pocket notebook I've got listed here to take notes on so that you can enter that information into the computer later. Calhoun envelopes we provide to you during class, and we can give you as many as what you need to get the clinicals done. You need to know where to find the incident reports and other student forms as necessary. And you need a complete change of clothing to leave in your car. If you're at an EMS or fire department clinical, I encourage you to take some snacks and stuff them into your backpack, just in case you're on to a long scene like a apartment fire where you're doing a standby, where you're going to be there for at least 4 to 5 hours. And as a student role, they're not going to allow you to charge a line or anything else, so you're just kind of sitting around. They're not going to go take you to lunch because you're hungry. Remember that we're on their time, so take some snacks in case you don't get a lunch break. I encourage you to take your textbook with you. Those are only going to be on the EMS rotations, though, or at the fire department if you're in the EMT program. In the ERs, I guarantee you won't have time to open a textbook and read. And then lastly, is the EMS Field Preceptor Guide, and this is available in the bookstore. We'll talk more about this on my visit to your class. Any questions regarding clinical orientation, policies, etc. can be forwarded to me. Again, I got my phone number and email listed there. It's also listed under contact information. Thank you, and have a good afternoon.